Hi, my name is Seth Kipnis. This is a informational video regards to help patients learn more about bariatric surgery or weight loss surgery, as well as long-term weight management. This is super helpful to watch before your first office visit. I've been the bariatric director of weight loss surgery at Jersey Shore Medical Center since 2009. I completed a fellowship in minimally invasive surgery, as well as I've been a board certified general and bariatric surgery since 2007. I'm the medical director of bariatrics and robotic surgery. I started the bariatric program in 2009. We've been a bariatric center of excellence for years. We've been accredited by the American College of Surgery program for quality over the last decade, if not longer. I first introduced robotic bariatric surgery to Jersey Shore Medical Center in 2013. And overall, our center is a comprehensive bariatric center. We are the first in New Jersey to have both adolescent and medical weight loss accreditation as well, in addition to being a comprehensive center. Our practice includes all fellowship-trained, board-certified bariatric surgeons. We specialize in physician-supervised weight management program. We meet all the insurance requirements for both surgical and any FDA-approved medical therapies that are currently out there to treat obesity. Our practice includes a full-time on-site registered dietitian who is part of our practice. We have a full-time dedicated bariatric surgery coordinator. We offer our patients full psychological support, online support groups. If you're interested in support groups, you would have to call our office for more information, as we do keep them confidential. We are primarily interested in long-term follow-up for improved outcomes over time. We're not just interested in having someone lose weight over a short period. We want you to really maintain that weight loss for your entire life. Everything we do is located at Jersey Shore Medical Center. Our office is next to and connected to Jersey Shore Medical Center in Hope Tower. Our practice has enjoyed being at Jersey Shore Medical Center, as it is a very large tertiary care medical center that can address any other medical issues that somebody has, whether it be heart, lungs, kidney. There are experts at Jersey Shore in all of these areas. We are a high volume bariatric center, and we have a long history of excellent outcomes. Overall, our complications are far less than national averages at Jersey Shore Medical Center. Our practice combined experience in surgery includes all aspects of bariatric surgery as well as general surgery. We do robotic and laparoscopic gastric bypass. We do sleeve gastrectomies. We use the Da Vinci for all different types of robotic surgery. We handle lap band patients. We accept lap band patients from all over. We handle adjustments, revisions. We do endoscopy. We also help people just with medical weight loss and any management of metabolic diseases that are associated with obesity. We also manage other common operations that are associated in patients that include weight loss surgery or not, including gallbladder disease, hernia treatments. We deal with the surgical management of reflux. We also repair hiatal hernias and paraesophageal hernias. We can do that at the same time as weight loss surgery. One of our other specialties is revision of bariatric surgeries. As a high volume tertiary care center, we often are seeing patients referred from other hospitals in the region, who sometimes patients are requiring conversion of prior bariatric surgeries to something new and different, or revision of a prior operation where something just isn't right. In general, we're doing all different types of general surgery and abdominal surgery in our practice. Overall, treating obesity is broken down into a couple of different aspects. First, we want to define what metabolic syndrome is. It's really not just obesity, but it's a constellation of diabetes, sleep apnea, heart disease, arthritis. There's all sorts of things that are associated with obesity that affect people's life. Our practice offers all types of weight loss strategy, both medical and surgical. We're going to go over the criteria for treatment, the different types of surgeries and medications, which are constantly changing, and the risks and benefits of surgery and medications. And again, at the end, I'll mention what the next step is. Overall, obesity has been climbing in the country. This is from the CDC. We are well past 2010 at this point, where a third of the state of New Jersey is considered overweight and obese. In the past, obesity was seen as a weakness or failure of the individual. This is clearly not the case anymore. Diet and exercise were really the only treatments. Many decades ago, weight loss surgery was viewed as extremely dangerous. That is no longer the case. And medicines really weren't effective. They were dangerous with complications. They didn't work to really drop significant weight. And all these treatments were expensive and not really covered by insurance, so it was difficult to offer them. Currently, obesity results from multiple risk factors, and obesity is considered a disease with serious health risks. This didn't happen until around 2013 when the AMA, American Medical Association, finally classified obesity as an independent disease. Surgery is an effective and accepted proven method to reduce obesity. Surgery is covered by insurance. Medications can also support overall weight loss goals, and we have happily introduced those into our practice. We are currently prescribing only FDA-approved medications. We are trying to use everything that's covered by insurance that reduces patients' cost. So overall, bariatric surgery is a proven method to help people lose weight, and medications are also should be prescribed to help people maintain their long-term health goals. When talking about weight loss surgery, the red line circles weight loss surgery. That's a BMI over 35 with medical problems that are associated with obesity, or a BMI over 40 with a medical problem with no medical problems. Eligible for medications has changed quite drastically and increased the amount of people that we are able to treat, as the BMI has been lowered down to a 27 with medical problems or a BMI of 30 with no medical problems. A body mass index is a measure of someone's height and weight. It's used to determine if you're qualified for surgical or medical therapy. It's not a perfect measure because muscle mass is really not considered when dealing with someone's just weight and height. Overall, anything that we do to get someone to lose weight is really all involved in how many calories you take in versus how many calories you burn. No matter what method we are using, has not changed. We do require severe caloric restriction in order to cause significant weight loss, and at the same time maintaining essential nutrients for your body so you maintain the parts of your body that you need. So why would someone choose bariatric surgery? Well, surgery is a tool. It is best indicated for higher BMI ranges, BMIs that are over 35 to 40, and people really need to have a lifelong commitment to weight loss, improved health. It is very effective and it is safe, but it does have some risk. Medications are also a tool. None of these will help you lose weight without changing what you eat. Medications can be for really all BMI ranges. It can start as low as a BMI of 27 with medical problems and up to 30 with nothing. Similarly, you also need to help with a lifelong commitment to trying to lose weight, changing your lifestyle, and is obviously safer with much lower risk than weight loss surgery, but can be less effective. In our practice, what we have been doing for the last several years is prescribing both. We often are using weight loss surgery as well as weight loss medications together. We can start someone on medications. We can consider surgery if it's not effective, if they've had surgery years ago. Sometimes we're able to prescribe medications years after surgery to help people keep that weight off in the long term. And overall, it's helped our practice to be able to treat more patients with maintaining their weight over the long term. There are different types of bariatric surgery. Most of our operations are all done laparoscopically or robotically. Open surgery really isn't done for weight loss surgery at all anymore. There are two main types of operations that help people lose weight. You can have a malabsorptive operation or a restrictive operation, and some of these involve a combination of both. The most common operation being done is a sleeve gastrectomy in this country. That is followed by a gastric bypass, a Roux-en-Y gastric bypass. Banding has kind of fallen out of favor, and a small amount of patients are looking to do duodenal switches or other malabsorptive operations that combine both restrictive and a severe degree of malabsorptions, but that's really not common. This is a gastric bypass. It is the oldest operation being done in the country for weight loss that's still being done. It involves stapling your upper stomach into a very small stomach pouch. This portion of the stomach is then disconnected. And then in second connection, is brought up to the top. So a brand new connection of small intestine is brought to the top. and that enables someone to lose weight. And a second connection is made here. So there's two connections that both need to heal. The advantages of a gastric bypass is you have a rapid initial weight loss. There's no device left inside of you. It's very effective for higher BMIs, and it's been around for the longest in the United States. It does have disadvantages. There are two connections that can have leaks or problems with the staple lines. You can get an infection or a problem with this operation itself. You can get a blockage in your intestines at some point, weeks, days, or decades later. Any of these connections can narrow, they can develop ulcers. The other issue with gastric bypass or any other malabsorptive operations like a duodenal switch is you really need to be on top of your nutrition, multivitamins. You are required to take certain vitamins and supplements for the rest of your life. Gastric bypasses also changes what you eat. Not everything that you eat goes into your stomach. Some of it will run through you very quickly, so it does affect what you put in your mouth. All weight loss surgery can have weight regain. The body becomes very effective at regaining calories, and if you don't make certain lifestyle changes, nothing that we do, whether it's surgery or medications, will cause you to lose weight permanently. This is a sleeve gastrectomy. It involves stapling and removing the majority of your stomach. There is one single long staple line that is made. Your stomach is cut and removed. That piece here is removed and is permanently gone. What you're left with is a very narrow, skinny shaped stomach, and that's really the operation. Once the operation is done, your anatomy is fairly normal, except your stomach is now much smaller. So what used to be the size of a football and stretches the size of a basketball is now a very skinny banana-shaped stomach. There's no device left inside of you. It is called a sleeve due to the narrow shaping of the stomach. It also causes a rapid initial weight loss. The weight loss can be a little lower than gastric bypasses, but it is safer than gastric bypass, where you really don't have any of those other small intestinal problems since this only involves the stomach. It does seem to lower hormones that control appetite. When this upper portion of the stomach is removed, people seem to lose their appetite. It is much better for high BMI patients that are too high risk for gastric bypass. Even though you may not lose as much weight with it, it's a much easier operation for a surgeon to perform, which means it's safer for a patient to have. Nutritional deficiencies are rare since all absorption happens beyond the exit of the stomach. However, it can still happen if you're really not taking what you're supposed to take in terms of multivitamins and nutritional supplements. You don't have any of the dumping syndrome or other things running through you too quickly, as there is no malabsorption with a sleeve gastrectomy. You still have a long staple line, so there is a risk of leaking or have a problem with the staple line healing. Some patients do complain of reflux or narrowing, or the sleeve itself has a stricture in the mid-body. If that happens, which is not common, sometimes it may require a revision. And sometimes people are concerned that they begin to eat poorly years after surgery, and you can have weight regain. So as I said, it's important to follow up with your surgeon. This is the lap band. The lap bands came out in this country in around 2001 and really stopped being implemented in 2007. It involves placing a small plastic cuff around the top of the stomach and then attaching the band to a port, which allows a doctor or a medical provider in the office to put a needle in the port and adjust the band, thus tightening it and making the stomach smaller or looser. As I said, bands have kind of fallen out of favor in this country. There's no stapling, cutting, or reconnecting of the stomach, so it is certainly attractive. When it first came out, it was a short operation. Most patients could go home the same day. Problems with the band is it had very slow weight loss. People really needed to follow up and get constant adjustments for critical results. The device itself has to be implanted forever. And over time, we've seen a high rate of removal of bands due to slipping, erosion, patients having problems with the plastic or silicone device that's inside of them. Adjustments sometimes are not being done frequently, and patients are lost to follow-up. And it really was replaced by the sleeve in 2013 due to people having better outcomes. Our last band in our practice was placed in 2013. There are many common questions that patients come to our office when they see us about what they may be interested in knowing about surgery. We do ask all patients to follow a preoperative diet. In our practice, we will give you a lot of paperwork when you come in about the special diet to help you lose weight prior to surgery. After surgery, your diet is critical, especially in the first month to 6 weeks, to allow your body to adjust to its different anatomy. Surgery takes about an hour for a sleeve gastrectomy and can often go home the following day. Gastric bypass can take a little longer, sometimes an hour and a half to 2 hours, depending if it's the initial operation or a revision. And often gastric bypass stay 2 nights in the hospital. Most patients who have weight loss surgery take about a week or two out of work. By 2 weeks, we do see most patients back in the office, and they're about 100% back to normal. Your weight loss is significant and will start happening pretty quick. Some patients will start losing 10 to 15 pounds in the first couple of weeks, and that really will increase over the first 3, 6, 9 months, and then levels out at about a year after surgery. We do like to see all of our weight loss patients at 2 weeks after surgery, and then every 3 months of the first year, and then every 6 months of the second year. And then after that, we ask to see you annually just to make sure you're doing well over time. There are many new types of FDA-approved medications to help people lose weight, and we've incorporated all of these into our practice. Some of the newer medications have been the most effective medications that have ever been produced in this country to cause a large amount of weight loss in a short period of time. These medications include effects that delay the stomach emptying and intestinal emptying, and it helps people to reduce their appetite and feel full much quicker. Some of these are injections. Over time, there may be new medications in these classes of medications that can help people really keep weight off and down. There are medications that suppress people's appetite. It removes their hunger and allows them to feel much better in terms of how much they want to eat. There are stimulants that have been around for decades that help people to burn calories better. There are addictive medications as well that can help people reduce habitual eating. And there are also medications that can help reduce emotional eating, that can do to sadness, loss, or loneliness. Many of the newer FDA medications that have come out have combined these effects to help improve weight loss and to minimize side effects over time. These medications are often being used in conjunction with surgery, where we are combining them with surgery. Either someone does not want surgery, they want something after surgery, or over time, sometimes we are using them years later after different operations. And all of it can be quite effective at helping people lose weight over time. There are common medication questions. Obviously, there is a diet that people need to follow after surgery. We do want you to be as successful as we can, and in order to do that, you really need to follow high protein and good nutritional intake while you're on these medications. It can take you time to get these medications. Sometimes there can be delays due to insurance, supply chain. Most of these medications, we don't really have an endpoint for people yet. We are using them in the long term. Different medications have different rules of how long we can be on them. Insurance does cover many of these operations. If you have no coverage for different medications or surgery, we do have options for you, things that are low cost and effective for you to keep weight off. The weight loss happens fairly quickly, and it's different depending on the different medications. We do like to see all of our patients that are on medications, usually a month after starting the medication, and then every 2 to 3 months after that. If you don't do well with medications, you can still have an operation to help you lose weight. We are only following FDA rules for these medications. So if you are not overweight or obese, then we are not really doing prescribing of any of these medications. They're really not designed to help someone look better for a certain event. They are really helpful to help you lose weight over time and to improve your overall medical problems and issues you may have. So overall, these medications are available. They are new and changing, and we are happy to prescribe them to help people losing weight before, during, or after surgery. As I've spoken about, there are many different improvements in metabolic syndrome. This slide kind of highlights the vast amount of diseases that we can treat by taking weight off people. It is really very effective at treating depression, sleep apnea, asthma, heart disease, high blood pressure, GERD, metabolic syndrome, in general can also include liver disease, high cholesterol, ovarian problems, fertility issues. Overall, what's next in order to be eligible for weight loss surgery is to call your insurance company and find out what weight loss methods are covered. We do ask you to make an appointment for a consultation. initially for weight management. Bring your insurance information with you to your first visit. If you need a referral, we are considered a specialist, and you do need to have that referral for your first appointment. Overall, if you are changing insurance companies or something else is changing in your life, please let us know. We can often find a better cost-effective method to help you lose weight over time. Any medical records or prior surgeries that you've had, we would love those records when you come to your first visit so we can get things done more efficiently. As I said earlier, we are only prescribing medications that are FDA approved and regulated. There are a lot of unique ways of patients getting medications, and we are just following those rules. This can sometimes take time, so please be patient with the process, because none of this is that quick and easy, whether you're doing surgery or medications. Thank you for watching, and we hope to see you in the office and to help you in your future weight loss.